I'm Pauline Tramantano. I'm a senior PTA here at Mount Sinai Hospital, and I work in the outpatient department, and I primarily see orthopedic patients. I've been working here at Mount Sinai for the better half of 16 years.
16 years. Well, Pauline, appreciate your time. We're talking about ACL, rehabilitation, and unfortunately, I think a lot of people in the audience, they've heard that three-letter word right there, ACL, a couple of times, whether hearing it on the news for sports or maybe someone that they know in their life. So we're going to get to the bottom of what is ACL rehab. So there are some phases in ACL rehab. Can you walk us through what those phases are?
Sure. The first and most important phase is trying to reduce the swelling. And we don't mean reduce the swelling as raise your leg and put some ice on it. We want you to move around a little bit in the first phase. We don't want you to be sedentary in a chair for hours and with the ice on your leg. You want to be able to walk around and try and get that swelling to dissipate. Of course, you're probably going to be with a brace and some crutches, quite possibly. But we need to reduce that swelling initially so that we can try to obtain full bending and flexing of your knee. Once we get the swelling down, we're going to be able to bend it and extend your knee better. And then obviously the very next thing would be to try to normalize a patient's walking gait. This is very important because for the first couple of weeks, maybe 2 to 3 weeks, it's very subjective to each physician and each individual surgery. Patient will be restricted in a brace with a Bledsoe brace. And these braces have dials on either side, and the physician can either increase the range of motion each time, the flexion and the extension, each time you see him. But you're going to really have some inactive muscles that you're not using during this phase. You also might be in crutches. So that actually affects a patient's walking gait or a person's walking gait post-ACL surgery. So we want to focus on restoring that gait and making it as normal as possible so that the swelling continues to stay down and we get that good bending and extending of that knee.
And then the final phase, what can people look forward to? What are they getting back to?
Obviously, for athletes, we're going to try and get them back to their sport of choice, whatever they play. For just regular lay people who are just trying to get to work and just have a hike on the weekend, we're trying to get them back to their activities of daily living initially. And then, of course, any type of physical sport that they do after we've obtained that activities of daily living, we were able to get them to perform them without any pain and with full extension and flexion. We want to get them back to being able to go to the gym and go back to their prime physical sport, whatever they did before they had the ACL.
All right. So the question everybody asks is, especially whether you're looking at a professional athlete on your fantasy sports team, maybe, or, someone in your family or friends or yourself, the question is time. How long does ACL rehab take? How do you usually answer that?
It's very subjective. It depends on a couple of things. If I see a patient and their goal is just to be able to get to work and perform their activity of daily living, mostly it would take anywhere between at minimum 4 months to 6 months. Patients who come to me and they're having difficulty getting that flexion and that extension, they might take a little longer. That might be the 6-month rehab. An athlete who wants to get back to their sport, they have to perform some running. It takes time for that graft to kind of sit in place and heal properly. So we want to take a little bit more time with those patients, and they might be with us for about 6 months because we have to return them to their sport. But generally, we're in the ballpark of 4 to 6 months.
We'll stay on the topic of time with this next question. How soon after surgery should I begin physical therapy? What's the time frame there?
Patients will post-op will see their physician anywhere between 1 to 2 weeks, usually 2 weeks post. At that time, the physician will give the patient a script to go to physical therapy. So we can't do too much that early in the ball game, but we can start to work on the swelling and whatever range that doctor would like that patient to be at that time. And usually they want patients walking and getting that range, that flexion and that extension in the knee pretty quickly. That dictates, how quickly they're coming to physical therapy. And usually it's within 2 weeks to 3 weeks of their first post-op appointment.
All right. So we're going to play a game here on the show. It's going to be called Two Things. We're going to do two things not to do. Let's start with not to do, and then we're going to do two things to do. So how about in terms of two things not to do? What would you tell people not to do with an ACL injury?
Sure. The one thing that patients, when I see them and they come in there for their first visit, I'll notice their footwear. That's the first thing. And most patients will be in crutches. They might either have a partial weight bearing status or a full weight bearing status. And I'll see their feet and they'll have either sandals on or they'll have a flat shoes on. And I always tell patients before their surgery, they should try to pick up a really good pair of supportive sneakers that would support their foot. The way we put our foot down and the way your foot reacts to the actual contact of the ground will dictate your arch of your foot and how that collapses. And if we have flats and sandals on, that will make your foot and your ankle do a lot of work, and that will travel up the chain and make the knee do a lot of work. And when we're post-op and we're that close to being discharged, to post-op, you want to make sure that you put some really good sneakers on and that have good support on your foot so that it allows that foot to roll better and it allows that knee to kind of take a break from doing so much work.
All right. So there's that one of those not to do. What's your second thing not to do?
Don't overdo it. Some patients tend to feel okay after 4 weeks of physical therapy. Maybe they've got full bending and extending of their knee and they decide, okay, I'm going to go hit the gym. Or perhaps, and then of course, do everything outside the parameters of what your doctor or the physical therapist has asked you to do. So that would actually create a setback. You'd have some unnecessary swelling. Now we've got to kind of, wait for the swelling to go down, try and get that range back. So don't overdo it. Some patients will come in after, treating them for 4 weeks and tell me that they just painted their living room. And so their swelling in their knee is pretty decent. And so now, again, we're hitting this setback. So try to adjust to the schedule of making sure that you don't overdo it and listen to your physical therapist and your doctor. That way we don't have any setbacks.
Perfect. All right. So footwear and don't overdo it are your not to do's. How about we end on a positive? What were two things that you tell people to do that you promote?
I tell patients as soon as I see them that we want to get the swelling down. Well, the most important part of your rehab is making sure that you obtain the ability to fully extend and fully flex your knee. Because without that, we can't start to really strengthen. And without that ability to fully extend and flex your knee, of course, within your doctor's parameters, if he's telling you that it's week 3 or week 4 and he only wants you at 90 degrees, then your therapist will also, hammer home that point. But trying to get that full range of motion right out of the gate is going to go a long way. And it also make your rehab in physical therapy a lot, I think. You won't be in rehab as long as you should be if you get that range quickly.
Sounds good. How about your second thing to do? What's your suggestion to make sure to promote?
The other thing I always tell patients when they leave physical therapy, we talked about in the beginning that it's generally 4 to 6 months of physical therapy, and everybody's case is subjective. But the one thing that patients do when they leave physical therapy is they don't continue some of their exercises. And it takes about a year for an ACL, a post-ACL surgery to fully heal. So patients will just go back to life as normal. And it doesn't have to be something where you have to go to the gym. You can ask your physical therapist on your last couple of weeks, listen, I want to make sure that I maintain things. What can I do on my own at home to maintain the musculature both above my knee and below my knee so that I can help aid in the healing. And again, it takes a full year. But I actually am doing some research on another procedure, and I read somewhere that it takes 2 years. Wow. If you look at some of the research. So really making sure you continue your exercises post-physical therapy will definitely help to keep your knee nice and healthy.
Well, thank you for the segue here. You mentioned exercises and post-therapy. You got to narrow it down to one for us. What's your favorite exercise to have people do post-ACL surgery? You got to give us one. What is your favorite?
Anything single leg standing. I like to do single leg standing variations and single leg standing. heel taps, single leg standing, ball toss. I like all the single leg standing variations because I feel like it really helps in terms of getting that torque in your knee nice and strong, because that's what the ACL does, right? It protects that knee from any type of unnecessary over torque. So I would say single leg standing dips, single leg standing, ball toss, anything where you're challenging the patient. And those things can get creative and fun too. So that's my favorite part of ACL.
All right.
Rehab.
Well, you've been there for 16 years working with people just like this. You've seen it. Pauline, appreciate your time. And thanks so much for giving us some insight about ACL surgery and what comes after.
Thank you.